maybe freezing, or if it's using rubber items by cleaning through the soft solution. Okay, so sterilization of the reusable equipment, because hospital mostly the some are like plastic materials, some are like disposables. After one time use we can dispose, but some are like ventilator, humidifier. Humidifier means hospital in that ventilator they are connecting humidifier is there. And any devices like IV stand, then we can use like we can reuse our what instrument for surgical only OT instrument, garments. These are the ventilators, IV stands. These are the reusable, not like a disposable type. So we can be contact with, we can be clean. This one is called the sterilization. Sterilization is the method of cleaning. Okay, cleaning the equipment.
Humidifier मतलब
humidifier is using in the humidifier means is maintaining humidity like AC, you know, as how they are maintaining the humidity in hospital, especially the ICU. The humidifier is to be there, and with a ventilator also. Inside and outside temperature there is to be maintained. Okay, this is the, you can search in the net that humidifier machines are there in the hospital. Okay.
Okay, ma'am.
Okay, that kind of how to conduct further through the sprit or antiseptic solution is to be clean, or maybe this product or can be used for the cleaning of the instrument. Next is the hand washing. Wash your hands properly so that we can prevent the infection. So how use soap and running water, rub your hands vigorously for 20 seconds, wash all surfaces. There may be, do you have seen 8 steps of hand washing? First palm to palm, next palm to back side, then interlock, finger interlock, like first palm to palm, again have back of the palm, then interlock, then after that in surface, in between the surface, then after that the thumb, like this. So 8 steps of that in the hand washing. So we have to be in health personnel, we are maintaining the 8 steps of hand washing. Okay. So when have to be hand wash before touching the patient, after touching the patient, before touching any patient, patient vomiting, any patient material at the time also after we have to hand wash, and this and before doing any like medicine, we have to give the medicine before giving the injection, that one also. Or if you are doing any patients, touching the patients at the time, we have to be do the hand washing. Before touching, after touching is the most compulsory of the hand washing time. Then third one is the wear gloves. So we have to be wear the gloves, like they reworn for 2 reasons: provide a protective barrier and prevent the contamination of hands, reduce the likelihood the microorganisms present on the hands will be transmitted to the patient during invasive and other patient care procedures. Invasive means IV injection, catheter giving, and central line giving. This one is the invasive procedure. Means we have to be we have to be open of the patient area. That one is called like only giving the oral medication. It is a non-invasive procedure. You have to remind two word: invasive and non-invasive. Invasive, where if you are pricking our patient's body, that one is called that. Pricking means opening the patient wound, patient giving the injection, catheter giving, the surgical procedures, central line giving. This one is called invasive, and non-invasive is a direct oral medication, because we don't need to be do any pricking of the patient. That one is called the non-invasive procedures. Okay, that time we have to wear the gloves if we are doing the any invasive procedures. But mostly I have seen in the hospitals and all, before giving the IV injections, the health personnel only use the hand washing, not sometimes not doing the not applying the gloves. But if we are doing with the HIV patient, hepatitis B patient, whoever syphilis and all, we are using the gloves for doing. Nowadays the coronavirus, we using the gloves also. I think two pairs of gloves used to be used. Then wear apron. This is the how doctors used to wear the apron, but in the OT there will be from the neck to the up to the leg, with the whole covered, whole covering green color apron is to be there. Wearing an apron during the patient care reduces the risk of infection. Apron is mask for preventing yourself from getting diseases. So you can see that all healthcare personnel in the like laboratory technicians, all everyone used to wear the aprons. Then functions, to formulate and update policies. For policies also, we have to be up to date in the hospitals so that we can maintain all the hospital infection control procedures, and review and approve surveillance and infection prevention program. Surveillance means what are the health oriented programs are there. We are in the advertisement how we used to give, that one also we have to be too. Emergencies of drug resistance, use of different antimicrobial agents, proper sterilization, disinfection procedures to assess and promote improved practices at all levels, so that we can give the up to the what cleaner levels, whoever doing the cleaning portions, like there, and also we have to be teach how to maintain the cleaning, how to maintain the cleaning, what have to be used for cleaning, and before doing they have to be wear a gloves, and also they, after doing all cleaning material, all vomiting and all, after the cleaning they how they have to do the hand washing and all, we have to be teach to the patient, to the that health personnel, health workers. Then last one is to obtain and manage critical bacteriological data and information, including surveillance data. Surveillance means who are affecting all of diseases. That one also we have to see bacteriological data, information.
Ma'am,
Mm.
ma'am, second, review and approve emergency of drug resistance.
Emergencies of drug resistance, review and approve surveillance and infection prevention program. Now, do you have seen now surveillance means how the infection programs is there? Emergencies of drug resistance, emergency of drug resistance. Okay, just first you say the surveillance and infection prevention program. Before corona came, no, before like how any antenatal postnatal mothers means pregnancy mothers, they have to take the folic acid and all. There are health programs is to there. Then pulse polio program. This is also one kind of a prevention program only. Pulse polio, if any vaccine is coming, that time also we have to be give. And one another, I have seen so many from the health programs. So many used to be there. What else to say? And for example, like surveillance program. Surveillance means for prevention of infections. But mainly the pulse polio program. Now it's corona program. Before for blindness control program, so many health programs are there. From that they have to give the advertisement for prevention of infections. This one is the approve, okay, review and approve. Because in the national health programs, then government they used to do the 5 years health program, national health program. They used to survey how many cases are newly is coming, how many cases already resolve the problem. Then you knew how wherever the cases are there, like malaria, which area malaria are there. So just some programs is to be coming out. So emergency, next one is the emergency of drug resistance. So we have to seek emergency of drug resistance. Review and approve. These are the approving program. Okay, functions. This is the inside of the functions. Means what are you have to be do? Drug resistance you have to say, because the tuberculosis mostly it's come in the T state T state area only, where they are not maintaining the proper. If once they are taking, means they are not negligence of taking the medications, because medication also is like a harassing only, is very strong. If they are not maintaining the protein, they are not maintaining the food items, they make it weak to the patient. So they don't want to take that medicine because it makes vomiting. So that's why the patient needs to be stopped that medicines. Again, they are taking that infection, as well as they are getting another kind of infections. You know that what HIV is not a disease, but if there is HIV infection is coming into our body, slowly our immunity power becomes very less. So then after that the pneumonia and another kind of infection is coming to the body. After that all will be totally is to destroy the body parts. Then it will be die a patient. Okay, are you now understanding or emergency of drug resistance? Because you have to be take it out the functions we have to do.
Okay, ma'am. Understand.
Okay.
Okay.
If you have any problem, you can ask me again. Okay. To ensure appropriate staff training is mostly important. Okay. Next is the safety management, needle stick injury, safety management like fire extinguisher, how to resolve the fire. These are the safety management in the hospital. Next is the development of policies for the prevention and control of infections. To develop, like development of policies means that I told you, no, catheter should have to be stay with the patient only 14 days. After that, it should be take it out and give the new one, or should we have to give the new catheter. So this is the one kind of a policies have to be developed in the hospital, every hospital, so that the all can be maintained and so the infection can be prevented. This is there in every hospital. And to develop his own infection control manual. So in every hospital, the manuals is to be there, monitor and evaluate the performance of program, recognize and investigating outbreak of infections in the hospital and community. Recognize, we have to be say investigating that any malaria is to be coming, new infection is coming like that, we have to be recognized and we have to take the proper action. And reduce patient exposure to pathogens. Pathogens mean infection, okay? Then reduce the number and virulence of nosocomial pathogens. Use aseptic techniques, proper isolation of the patient, known or susceptible harboring whenever possible. Avoid crowding. Then you use gloves, wash hands, masks, eye protection, ground where radioactively likely to generate splashes or sprays. Then ground, protect skin and soiling of clothing. So in every health personnel, we have to wear proper. This is also called a personal protective equipment. Okay, PPE. This is one word you have to be learn to know. That one is the PPE. This is the personal protective equipment. Gloves, masks, caps. Now, how all health personnel are using in the attacking of corona warrior? You have seen the pictures now. How that this is a personal protective. I think these were very now very familiar of these words. Yes or no? PPE, personal protective equipment. So this is a mask, eye protection, ground. This is all are called the PPE. Okay. So SARP is mainly the needles. Avoid recapping of needles. If we are giving the injections, if we again recap, if when we are burning at that time, if a needle prick is there to you, that may infection that from the needle, that infections may be come to you. That one also one of the needle from the needle stick injury. It is called a needle stick injury. Okay. Then avoid removing needles from syringes by hand. Please use sharps in puncture-resistant container. This is the how puncture-resistant container is a burning container where you used to burn our needles after giving the injection. Okay. Now ensure clean environment. Establish policies and procedures to prevent food and water contamination. Establish a regular schedule of hospital cleaning. Dispose the medical waste. This disposal, how to do the biomedical waste management, I will discuss. Okay. So many items are there for disposing, how to dispose, what to have to do, the segregation, and I will discuss in the biomedical waste management. Then dispose of medical waste safely. Needles and syringes should be incinerated. Other infected waste can be incinerated or autoclave for landfill disposal. These are this last one also and this one also. This is inside of the biomedical waste management. Okay, I will tell you there are so many color coded will be there how to dispose the items in the hospital especially. So these things will be discussed on biomedical waste management topic. So your hands can be dangerous. So wash them with soap and water to keep bacteria away. So hand washing, the steps are there. Palm to palm, then left palm to over dent, rub the palms interlock, then thumb. This is the 8 step, 6, 7, 6 steps is there here. I'll show you the 8 steps. Must be bacteriologically effective. Wash hands after touching infective material. These are all. So there is no official national approaches and no real managerial support from authorities for nosocomial infection. We have to be this. We have to give the training to the all healthcare personnel so that the infection can be prevented. So do you have any questions, any query about the topic infection control? About the infection and infection control. You know that infection is coming from the bacteria and viruses. It may be come to in the environment. It may be come to the touching to the patient. Do you have any query? Any doubt? You can ask.
No, ma'am.
No. Others? If you have any query, you can ask in my personal WhatsApp or maybe in the group. Okay, group WhatsApp also. If you're asking group WhatsApp, is maybe very easy because every student can understand. Okay. Can I end?
Okay,
Yes.
Okay. Can I end this one? I will just.
okay, ma'am.